So I'm using a roller called the Melt Method roller. It's probably backwards. Melt is a brand name, and it's really soft and squishy, so it's quite safe for the spine. So if you have osteoporosis or osteopenia and you don't have a soft roller, I would skip this exercise. So I'm going to start by placing the roller down, and I'm going to lie on it with my shoulders on it. I'll take my hands behind my head. That helps support your head weight so your neck doesn't get strained. And I'm going to lift my hips up into a bridge, and then from there I'm going to push the roller down with my feet. And as I push the roller down towards my bottom ribs, my head comes up and my hips come down. And as I go back up to the shoulders, the hips come up and the head goes down. And just keep going back and forth like kind of a rocking motion as you roll the roller up and down the spine. It's really just the rib cage, bottom ribs to shoulders. If the elbows are forward a little bit, you can get the shoulder blades out of the way when the roller comes up towards your shoulders. So you're rolling on spine and muscle and not so much on the bones of your shoulder blades. I'm just going to reset down here a bit. And you can go up and down as many times as you like. And then we're going to finish by coming down to the bottom ribs and just setting your pelvis on the floor. So the next part of the series is a little bit like the thoracic mobility exercise. We're starting at the bottom of the ribs, just about the bra line or a bit below it. Again, the hands can be behind the head. And I'm going to side bend, so one elbow comes towards one end of the roller, and then on the other side. And of course, the range of motion is completely up to you. You can do a small range of motion if you're worried about your spine. But if you're not, you can do as full a range of motion as you have. Make sure you're breathing, because it is a lot of pressure right at the diaphragm there. You're kind of pushing the bottom ribs in. And then we'll come to center. And now you keep your spine in center, but you turn, you rotate to the right and left. Whole body's kind of straight. All right, so I'm not in that kind of flexed up position here. And then we'll come back to center. Lift your hips and take the roller up a few more ribs. Side bend. Okay, Mushy. Cat wants to come in. And then come to center. Rotate. Just a minute. And then we'll do one more place. I'm going to go up a little higher. You can get your shoulder blades out of the way. Side bend. Just a little kind of a twisting motion of the skin on the roller. And then rotate. Don't have as much rotation here. You're kind of blocked by your shoulder blades a little bit. And then you can finish by doing a few more of the rolls up and down. So there's a nice little thoracic mobility series you can do if you have a soft roller. There you go.